Yes. So good afternoon, everyone. Is my voice audible, clearly audible?
Very good. Clearly audible. Congratulations.
Uh, Thank you, ma'am. So good afternoon, everyone. I, Mansi Randri, welcome all the members to Global Women Network for Nature's monthly meeting. And a warm welcome to our today's guest, Dr. Jayati Chore, ma'am, Executive Director, Saki Waters, and our founder director, Dr. Vinita Apte, ma'am, Terre Policy Center. Today's meeting embarks on a journey into our topic, mainstreaming gender into climate change and water policies and actions, which will be presented by our today's guest, Dr. Jayati ma'am, Executive Director, Saki Waters. I request our founder director, Dr. Vinita Apte ma'am, Terre Policy Center, to welcome our esteemed guest and GWNN members. Over to Vinita ma'am.
Thanks, Manasi. Good afternoon, everyone. All the GWNN member who are even on YouTube and Zoom. And a very grand welcome to my friend, my little friend, we can say, Jayati. Today's the topic of Jayati is actually everyone's topic near to the soul. Everyone, like last few years, everyone is listening that and reading through the many stories that the world war, if it comes, it is definitely for the subject on water, because water is our life, and we all are depend on every small things for water. And Jayati dedicatedly working on these issues, especially on the urban water scarcity. She is with us last 2 years. We are partnering in one consortium, and I saw her from a very near things like about her passion, about her dedication towards the water. And I must say, I'm very much thankful to Jayati, because of her, we the urban people get a new vision of urban water. And I really appreciate that the members who are on this platform of Global Women Network for Nature are very dedicated people working for climate and nature, and Jayati is one of them. So I just want to listen to her for today, and that's why I'm stopping here about my speech. I'm not that great for giving a lot long speeches and all, but I always appreciate to learn from this forum. So over to you, Manasi. You can introduce Jayati in a proper manner, and we will go for her speech. Thank
Uh,
you.
Thank you, ma'am. Thank you for your inspiring words. Moving ahead, I would like to introduce our guest for today. We are honored to welcome Dr. Jayati Chowre, ma'am, the Executive Director of South Asia Consortium for Interdisciplinary Water Resources Studies, Saki Waters. Jayati, ma'am, Saki Waters, a distinguished non-profit organization based in Hyderabad, India. Established in 2002, Saki Waters is dedicated to fostering water secure and climate resilient sustainable ecosystems and communities across South Asia through action, research, education, capacity building, and grassroots level implementation and policy advocacy. Dr. Jayati holds a PhD in ecosystem based and integrated water resources management from Indian Institute of Forest Management, Bhopal, affiliated with Forest Research Institute, University, Dehradun. She also boasts numerous certifications in environmental social governance, ESG frameworks, GRI sustainability reporting standards, life cycle assessment, carbon water footprints, and ISO 14001 2015 environmental management systems as a lead author, lead auditor. Over 18 years of extensive experience in natural resources management, climate change, and sustainability. Dr. Jayati has contributed significantly through her work with environmental consultancies in international development organizations, academic and policy research institutions, and rural community based organizations across South Asia and Africa. Her professional interest includes climate change vulnerabilities, climate justice adaptation, and water management. Currently, Dr. Jayati leads pivotal research projects on climate change vulnerabilities in Sundarbans, India, and a coastal resilience building in India, Bangladesh, Sri Lanka, and Maldives. Additionally, she is actively engaged in initiatives aimed at ensuring safe water access for water marginalized urban poor communities, advocating for water as a human right. Please join me in extending a warm welcome to Dr. Jayati. With this, I would like to hand over this floor to Dr. Jayati ma'am. So over to Jayati ma'am. The floor is yours and you can start with the presentation. Thank you, ma'am.
Thank you so much, Mansi, for such a detailed introduction. And Vinita ji, special thanks to you for inviting me today for this webinar. And I really appreciate and I feel honored. And also your kind words for me. So, should I have a PPT? Not like I don't want to give a very formal speech, but I'm here also to learn from you. The idea is that I share our experience and learnings, and also I'm keen to hear from all of you, which will definitely help us to learn more from you and also to improve our strategies towards gender mainstreaming in water resources management in the context of climate change. So can I share the screen? It's just to give you some visuals to keep the context.
Yes, ma'am. The screen sharing option is on.
Okay,
You can share
yeah,
your
I'll
screen.
do that. Yeah. So are you able to see my screen?
Yes, ma'am. It is visible.
Yeah, sure. Thank you. Um, So, Mansi has already given you a background about Saki Waters. We started in 2002, and then we worked towards contributing to water secure and climate resilient, sustainable ecosystems and communities. And I would like to highlight here that our one of our three approach includes promoting gender or ensuring gender inclusiveness in climate change and water resources management. And then other two are like we believe that water is like one of the human rights, and it has to be taken as a way or entry point towards community development, and then ecosystem based and integrated water resource management. This is also one of our key approaches. And then we have different thirst areas where we are working. We work on climate change, then gender is like one of our major focus, then water policy and governance, ecosystem rejuvenation, water quality issues, and then we are also supporting businesses with ESG strategies. So any of our initiative what we do like here. So any of our initiative actually has 4 pillars. We begin with proper research so that we it can inform actions. And then we are also into capacity building, because we believe that it's very important to build capacity of the communities and stakeholders to ensure the sustainability of the initiatives, and also to see that there's a feeling of ownership. And then we come to grassroots implementation. We also support communities with grassroots implementation. And then we believe that we shouldn't stop there, but we should also are also like the or replicable models which we come up with should also inform policies and should also amplify voices of marginalized people. So we believe in building collectives and collaboratives. So this is a like brief idea and overview of our initiatives over past 2 decades. So now we come to today's topic, that is mainstreaming gender into climate change and water policies action. Now, here I would like to underscore that when we talk about climate change and water, so I feel that we need to understand this integration. First of all, like now, even UN has recognized that water crisis, climate change crisis, is essentially a water crisis, because all the impacts of climate change are basically felt around water. Whether it's extreme events, you have droughts, or you have floods, you have sea level rise, you have salinity, you have cyclones, you have um, uh, like heavy rain. So everything is about water. So we should always keep in mind that climate change is basically a water crisis, and from that context, we are discussing that how to mainstream gender. So first of all, it's very important to understand that it's the role of women and men play in the society. Uh, so this South Asia is, when it comes to climate change and disaster, so South Asia is recognized as one of the most vulnerable region to climate crisis and disasters. Um, and then efficient and proactive climate change mitigation, resilience and adaptation demands equal involvement of men and women. Now, when we say that equal involvement of men and women, we need to see that whether women have that kind of capacity at present to represent at the different level, because most of the time our projects, they consider women as just beneficiaries. So now this is the time where we need to understand that we need to move beyond considering women as just mere beneficiaries. um, yeah, and ensure their involvement in planning and decision making level as well, because the role women play around water. We'll come to that in the next slide. So this slide is just basically crux of this discussion today. So there's a like high time we need to bring women into decision making and policy making processes. And then talking doesn't help. It also requires investment in capacity building through skill development and education. Efforts also should be complemented by creating an enabling societal environment. That is very important, because whenever we talk about women empowerment, we talk about only women, but then we also need to see that the kind of paradigm shift we want to see can happen only when we have supporting and enabling societal environment. And that is something lacking when it comes to gender empowerment and gender mainstreaming initiatives. uh, then yeah, so and then we need to actually amplify voices. We need stronger narratives for gender responsive policies, inclusive institutions and community engagement to empower women in both water and climate change actions and policies. So this is like just what we are going to talk about with some examples. So I'm because when I spoke to discuss this with Vinita ji, she said that you can share initiatives of Saki Waters in these areas. So that's what I'm doing. But then while I'm sharing them, I will also look forward to hearing from you because it shouldn't be like one way sharing, but I'm also interested in learning from all of you. One thing is like when it comes to climate change or water, because I'm integrating both these two because they are not different. Not even these two in nature, everything is interconnected. Nothing lies in isolations, in silos. So when we talk about water, so water scarcity and contamination and also climate change impacts disproportionately impact women and girls. Um, for women, I'm just giving you some pointers. So for women, the water crisis is embodied as physical and social burden, as they are instrumental in securing access to water in the household. So we all know because we all work in this sector, so this is nothing new for all of us, but just it's a reminder that women always has been playing a major role when it comes to water management at the household level and at the community level. So they have this gifted wisdom to manage water or manage crisis. They are very good at that. But the unfortunately, or the irony is that women are underrepresented at the policy making level or at the decision making level or at when we talk about technical job or leadership roles, because we see whenever we imagine an engineer, even now like things are now changing, but still like whenever there is a field based job, whenever there is a technical job, like we have the stereotypical image that only men can do that. But then that has to be changed, and that is like we see a lot of change now happening in the society. And then growing number of evidence show that involving men and women both can increase project effectiveness and improve the likelihood of the sustainability. But still, like even we realize this, everyone appreciate this, like still yet women have negligible voice in water management, governance, and policy making. um, Therefore, there's an urgent need to engage women in decision making processes, uh, not as just the beneficiaries, but as a powerful agent for promoting sustainable development and effective responses to climate change. So I have time till 3, or because then I'll
Ma'am, up yeah, up to 3:15, and
okay,
last 15 minutes we have question and answer session.
okay, okay. Thank you.
Thank you, ma'am.
So before we start discussing this, I would like to present some case studies or illustrations from both um, uh, urban and rural setup. And also when we are discussing about capacity building and women empowerment, we are talking about these like actions or initiatives at different levels. It's not just communities, like we are definitely talking about the women at community level, but we are also talking about um, as I said that societal environment is also important. So we are also talking about different stakeholders and women or gender responsive actions at various level, like community level. Then you have these administration level, and then also professional. We also need more and more women professionals, or we need professionals who are gender sensitive. The first illustration is from Sundarbans, where we have been working since 2022. We all know that Sundarbans is a like renowned ecosystem, and then it supports world's largest mangrove forest. Um, and then this is like This is a patchwork of many low-lying islands in the Bay of Bengal. So whenever we talk about this Sundarban, so it's the major focus is on ecology and mangroves. That's definitely important. I'll just go to the yeah. So I'm talking about one initiative in 20 Sundarban, the South 24 Parganas from Sundarbans, which is called Cyclone Capital of India, because the intensity of cyclone is very high. Like they have this index, so as per that index, it's 1.5. That means after every 1.5 years, they are hit by cyclones. So that's why, and also because these are like low lying islands, they are also prone to sea level rise. So it's like one of the most vulnerable geographies on this planet when it comes to climate change impact. In fact, if when you visit Sundarbans, you can see the strong manifestation of climate injustice, because these people are the ones who have contributed the least towards this global climate change issues, but then they are at the forefront of climate change impacts. So around 4.5 million people are living in on 54 islands out of 102 islands in Indian part of Sundarbans, and they are majorly relying on fishing, agriculture, collection of wood and honey. Um, so yeah, as I said, that we started working in 2022, when we were trying to understand the impact of climate change on migration and children's health, child protection, because of increased salinity in the region, because of sea level rise, cyclones, storms, and saline water intrusion. Now water and salinity in water and soil has increased, and that has it's like scientifically proven that that has reduced the yield of agricultural protection, agricultural yield, and also these cyclones bring a lot of destructions, and ultimately it impacts their livelihood. So you will see that a lot of men there, they migrate to cities, and then women are the ones who are left behind, and then they are responsible for taking care of children and elderly in their families. So this is the overall scenario. So when we were trying to understand the impact of climate change on migration pattern and child protection, we came across something very which was at a very large scale, but hardly spoken about. That was like impact of climate change on women. So uh, like we can see that sometimes it's very hard to imagine that how climate change in Sundarbans is impacting women, and that to menstrual and reproductive health of women. So when we were discussing them about like their children and other issues, then they started sharing that they are actually facing a lot of impact on their menstrual and reproductive health. They are suffering with uh, recurring urinary infection, and then irregular bleeding, heavy bleeding, white discharge, and then also in severe cases, they reported uterine tumors and cysts. So this is something like it's very interesting to understand that how climate changes can impact like this, because we understand that it impacts ecosystems, it impacts livelihood, but then it has like far-reaching impact on the communities, and this is one of them which is generally not discussed in open because of a lot of taboo and stigma around it. So we then started this action research. It was supported by Adaptation Research Alliance, and then we tried to um, find find adaptation solution to menstrual health risk induced by climate change through knowledge co-creation. So what we did was we started we started with interviewing 400 women. We had informal group discussions, and then we formed participatory action research group. So we need to understand this within the context of today's theme, that we try to actually involve and engage with the women from the beginning. So we also actually saw them as co-researchers. So what we did was we worked in two of the most vulnerable blocks, that is Gosaba and Patha Pratima. We selected two island villages from Gosaba, that was Chandipur and Hetalbari, and in Patha Pratima it is Mahendranagar and Durbachati. These are like remote island villages where you don't have any health facilities. Even for a small little fever, also they need to travel. And then you need to understand that connectivity is not that easy, because this is only these are remote island villages. So only through ferries and boats you go to this block level hospitals, and then there also they have basic facilities. So and then we had this participatory action research groups where we involved them. Then we also conducted the block and state level multi-stakeholder knowledge co-creation workshops. And then we also created campaigns. And before I come to the like action part, I would like to share the finding, that how it happens, how this is impacting menstrual and reproductive health. So as I said that most of the time, like men are they migrate, and then women have responsibility. So one thing is like in West Bengal, fish is like the main part of their diet. So women, even they are not involved in commercial fishing. They go there and they spend hours like prolonged uh, uh, time in periods in these ponds and rivers. Like here, because it's a like delta area, like this estuarine system or riverine system is naturally saline, but they're also like now the salinity is increasing because of cyclones and then seawater intrusion. So now the salinity has increased, and because of frequent floods, even their freshwater ponds are getting contaminated with salinity, and also environmental pollution, because the pollution, or like in upstream you have this industrial belt, and then this pollution from these industrial belt ultimately reach this area. So even these rivers are contaminated now. As a traditional system, coping system, Sundarbans, in Sundarbans they have this small ponds, means almost every family they own their own ponds. So now what happens, like with floods, the saline and contaminated water reaches village. It floods the entire like whole village, and then it remains there for a few days, and that actually contaminates the ponds water also. So now right now they don't have any other sources. So even for bathing they use the same water, like pond water for everything. Only for drinking water they have limited number of uh, tube wells in the village. So they just collect whatever is required for drinking, and that is also like even now water, groundwater is becoming saline. The salinity is even increasing in groundwater. So what happens, like they take bath there regularly. So this is like that exposes them to this contamination. That's why they are regularly having all kind of infections. And also they used the same water for cleaning their menstrual cloth also, because they like it's also a typical case of period poverty, because they are not able to afford hygiene products. So they rely on a cloth, and then they use it like wash it with the dirty water, and again it leads to infections. And then second, like as I said, that then the secondary exposure is when they uh, go for fishing. Like here in this picture, you can see they actually stand and fish in like waist deep water for like 4 to 5 or 6 hours, and then that is causing a lot of health issues in them. So what we did was like we tried to understand what could be the solution, because they know it better that what can work for them and what will not work. And then we also try to because see, the root cause is water quality there, because it's impacting by both climate change and also environmental degradation. So water quality is one thing, but at the same time they also need immediate um, solutions. So then we also gave them this training in manufacturing sanitary napkin, that is especially like biodegradable ones. So that was also done. So this is like a brief about our initiative. So here we actually understand, like these are like some glimpses from our like in activities, trainings across these two blocks. So here we need to understand that how like most of the time when we have discourses around water, around climate change, we hardly talk or think about such issues. So that's why it's very important to amplify these narratives, inform policies, that policies or adaptation strategies, resilience building should be climate should be gender responsive and also gender inclusive, because we hardly discuss when it comes to water resources management or when it comes to climate change strategy. We hardly discuss about such issues like menstrual and reproductive health, especially menstrual health, because mm, uh, I'll give you an example. When we were trying to understand that how many, at what scale this problem is within these communities, then we asked ASHA workers, "Do you that how many cases you get?" Then they said that we get many cases, but we don't maintain this records. Data, because we are asked to maintain record only about waterborne diseases, especially after floods and disaster. We maintain record about waterborne diseases like malaria, dengue, diarrhea, or sometimes like we do cater this women, but it's mainly during the um, during the pregnancy, nutritions, and all those things. So we are never asked to maintain data about these patients. So that is like, that shows the ignorance, that shows that how gender neutral our policies and strategies are. So this is a case which actually presents a strong narrative that why do we need gender inclusive and gender responsive policies and strategies when it comes to water and climate change. Now the second one case, because we don't have much time. So second case is from urban areas. So right now, like we just saw that how in rural areas we saw that um, there's hardly any like we saw that how gender these climate change vulnerabilities are, and we could understand that okay, they are remote areas, they are remote islands, and they are like hardly people know about their situations. Mm, we could understand that it's very difficult to provide all kind of facilities in such remote places. But then when it comes to urban areas, then even the situation is not like better, it's sometimes even worse. And then unfortunately, like these are the ones basically they were suffering in the village, that's why they have migrated. So before so this is like I'm just sharing a story from, or a case from Hyderabad, where we are based. So here they have this mission. So here again, I'm actually trying to underscore that how uh, government policies or government schemes are gender neutral. they just don't think that women have special needs, women are impacted differently from men. um, so like in 2023, yeah, last year, we did one situation analysis of Mission Bhagiratha. Mission Bhagiratha um, is flagship program of government of Telangana, and they claim that through Mission Bhagiratha they are successful to provide piped water supply to 100% of the households across Telangana, and that's true. Also, we did this situation analysis, and in 2022 they were also awarded by the central government as one of the like as the best water supply scheme in India. We have been working with under like these underprivileged or urban poor habitations. We like have worked in slums extensively, so we wanted to understand that how this mission has helped this slum. So we revisited the slums where we worked earlier, and then we were very happy to see that they are satisfied. Like they now have much better water quality supply in terms of like both quality and quantity, so they were satisfied. But during that, we came across certain pockets or certain sections where people are living in informal settlements. Informal settlements here, I mean, like they don't have permanent housing. You can see in these pictures, they live in these makeshift or shanty kind of uh, arrangement. So what we realized that the major shortcoming of this Mission Bhagiratha was that it is household based, and once if you have a house, you will get water, and it is 20,000 liter free water for everyone. Even I get 20,000 liter free water every month as part of this scheme. So this scheme provides the water to all the houses. But what if you don't have a house? Then don't have a access to this basic or fundamental need of life. So we came to know that people who don't have house, so it included actually most of the time we found that they are garbage collectors. So it's not just because they can't afford a housing, but um, they say that no one allows us to actually rent their houses or live near their houses. So wherever they find this open space, they make their houses there, and they keep moving within the same locality. So here, like they don't have access to water, and these are the actually and then these also include homeless, or these also include climate refugees, migrants. So these are the like most needy people, and then they are forced to buy water. So now we have an initiative on providing drinking water uh, to these people in informal settlements. It's so because sometimes it's not just that government doesn't want to give them water, but it's like because they live in such place which are high risk areas, zones, and also sometimes encroachment in the prime location. And if government gives them water and electricity, then it's their responsibility, because they are living in risk areas, and something happens, then government will be answerable. So that's why they are not able to actually provide any facilities. But then we believe that water is human rights. Whatever you do, wherever you live, you should have access to water drinking, and also for wash. So yeah, so then we have this program now with government of Telangana, and this cooperation agreement between government of Telangana and Board of Metropolis. So we are trying to provide water through water ATMs. We have just started this initiative, but now it's not just the drinking water, because drinking water they are buying, but it's also now beyond that. The problem is with sanitation for these people, and especially for women, because they get limited water. You can see in one of the pictures, like they get water once in a 4 days, and sometimes once in a 10 days, like especially during summer when there is a scarcity of water. So then these people buy water even from these tankers. It's not free supply. They buy water, and then they don't have any toilet, because when you buy water, you actually keep it for very like important area things, like for drinking or for especially men get they are like prioritized when it comes to allocating water. And so just imagine what happens when during the menstruation, because see, we can go and teach them about this menstrual health and hygiene, but how they can actually achieve it if they don't have water, they don't have toilets. And then see, there are some public toilets which are like paid ones. Just imagine paying 5 rupees per time is not possible for them, especially. So most of these people, they actually still go for open defecation. And the sad part is like this is not some in some remote areas, this is right at the heart of the city, such pockets. So when we're talking about when we plan our water manage urban water management or any kind of water supply scheme, do we think about such situation, that how because these women they came to us and they said that, see, drinking water somehow we have managed to buy, but can you help us with the toilets? And then because see, one of the women, she said that, see, my adolescent girl daughter, she faced a lot of problem, because every time she needs water, not only water but also space for changing their pads and for washing, and then hardly any facility. So they are, it's like their day to day struggle. So the point is that how gender responsive or gender inclusive our policies and schemes are. Whenever we talk about water resources management, water supply, we hardly think that what happens with these kind of people. Because see, men can even women actually face water because they cannot go outside during daytime. They have to wait. And what happens when during the rainy season, when their areas are flooded, during the droughts, when they don't have water? So we need to think that how women, like men and women, are impacted differently. That's the reality, because men definitely they have their own challenges, but then they don't have this kind of biological challenges. So all our governance institutions, our governance system, our plannings, policy making, they need to be inclusive. And that can happen only when we have women, because only women can share their pains. They know, they can share their perspective, they can share their needs. So it's very important to have women at various level. So these are about the communities. Now I'll quickly talk about our initiative at at like capacity building at a water professional, like how we supported women water professionals. So we from 2005 we started working on gendering water and climate change science education in South Asia, because we believe that we need more and more women water professionals, women leaders, water leaders who can actually are empowered enough to actively or efficiently participate in these policy making or decision making processes, because it's very important to understand women's perspective, it's very important to understand women's need, it's very important to acknowledge and appreciate and use women's wisdom, because they are the ones who are also suffering, and also they are change makers. They are like born leaders. So we started a program called crossing boundaries. So through crossing boundaries initiative, we designed and initiated masters and doctoral programs in gender inclusive integrated water resources management in 4 South Asian universities, in Nepal Engineering College, and then Bangladesh University of Engineering and Technology. In Sri Lanka it was it's Paradenia University, and in India, Center for Water Resources, Anna University. So at these in these universities, we launched these programs, we supported them, we conducted training for trainers, like we trained their faculties, and then so what we did was like what was the idea, that in South Asia generally water resources management is very technical or very engineering based. So any water professionals or water managers you would need will most of the time be a civil engineer. So every time, like when you have any issues, when you have any problems and you reach out to them, the solution they offer is always concrete and engineering based. So that's what like you see, and they completely lack uh, awareness or sensitivity towards other aspects of water. We believe that water is not just commodity or H2O. It's a living ecosystems and also part of larger ecosystems, and it has many other aspects around it, like for example health, gender, communities, like cultural and historical significance, traditional knowledge, uh, uh, all these. So when it comes to like what decision making, generally these engineers, they just talk about like, okay, build a dam, build a check dam, or interlink rivers. Whenever you talk about water scarcity, they say, okay, bring water from some 500 kilometers away river, and then like supply water to these urban areas. So and that's how the example, like this Sardar Sarovar dam issue, like there was so much of conflict between communities. So many people were displaced, acres of forest ecosystems were submerged. So why it happens? Because there's a lack of understanding. So with this idea that if we want to see this paradigm shift, we need to have like longer duration education inputs, because they play crucial role in equipping participants with necessary knowledge and skills, along shaping attitudes and perception required to uh, bring in this kind of paradigm shift in the society. So what we did was like these programs were basically engineering programs, masters and doctoral, and then we introduced different credit courses. For example, we introduced a course on water and ecosystems, water and gender, water and communities, water and health. So there were like some 12 program curricular credit courses we introduced. We gave them training on interdisciplinarity. So we wanted to actually bring in interdisciplinarity in the way the water is managed. As part of this, we also published a book, like series of book called Water in South Asia, to provide resources or reference material for this kind of hybrid new style professional courses. So here we made sure that it also has to be gender inclusive. So I'm talking about 2005 when we started, because now we see a lot of women leaders in the ministries and even in the society, but that time it was very rare. So when we started, we thought that it has to be one, like more and more women should enter into this sector, and also others, like creating society, like in an enabling society, a societal environment. We also need to work with other stakeholders. So that was the idea. So we also provided this SAWA fellowships, and 75% of these SAWA fellowships were meant for women. Sorry. So we had I think that is not visible. Yeah, so we have around 75% of fellowships meant for women. And then we also had gender, water, and equity trainings for different stakeholders, so that they can bring gender inclusiveness in their day-to-day practices related to water resources management. And so here, like our long term, because these programs are also on. So we had crossing boundaries project, then we had SAWA fellowship program, and right now we have in these universities SAWA leadership program in water and climate change. So through these we wanted to create more and more women like role models for in terms of women water professional. And then we also did a lot of advocacy activities, a lot of publication, a lot of uh, research action. And then we also gave them like research opportunities in the field, and also not just the financial support, but we also provide mentorship, support, other kind of networking support to these SAVA fellows. Yeah, so basically, so these are like long term, because any kind of societal like change in the society takes time. So our long term anticipated outcomes are like our funding initiative, like this SAVA fellowship will eliminate discrimination among young women in STEM, because we'll give opportunities to more and more women to pursue this kind of professional courses. And then yeah, as I mentioned, that role models, and then also employers in the water sector. So for example, now if water sector or the sector or the society is ready to welcome women, so women should have, like, they should have options. Now you have well educated professional women to be in these places. And then these change, they actually also act as change makers. So like communities in which these our fellows reside will definitely benefit from improved education and research outreach of these fellows. So this is about our initiative. So this is from my end. So thank you so much for your patience listening, and I welcome your I'm actually really looking forward to hearing from all of you. Thank you so much.
Yes, thank you, ma'am. So it's time for our question and answer session. So participants can start asking their questions one by one, or else they can just raise their hand in the chat box. Yes, anyone?
So if you also have like similar experiences, I would love to hear from all of you.
Yes, anyone, please?
Jayati, I would like to appreciate you, though, for this very comprehensive and self-explanatory presentation. I really appreciate the work which you are doing in the villages, especially in the remote areas. And I wish, I mean, everyone have a lot of problem and questions regarding this village women, especially in the water scarcity thing. But how you are managing to go in that remote place is my first question to you.
Yeah, actually, yeah, like during this action research, even I was involved in the field work, because I love to be in the field. I'm basically a field person. So though I had a team, but then I made sure that I'm always there, because it's an like something which I wanted to learn. And then until and unless you don't visit these areas, you don't have first hand experience, you don't actually understand the issues. So it was interesting, like these were remote areas and we needed to take ferry, and it takes time, but it's like quite exciting.
Right, right. Because I remember the last year when we were in Bangladesh in Shamnagar, no, that cyclone village, the villagers are really drinking the muddy water, and I cannot even stand in front of them for a second. I ran away
Yeah,
from that place.
it's yeah, actually when we started, so first time when I went there and we had a like informal meeting, So they were sharing this like about the water qualities, and then they have these hand pumps. So I thought like I should taste this water so to understand what they are complaining about. And I actually took a sip, and I could not take it more than one sip because it was tasting. It was not just salinity; even that taste was that odor was so horrible. And we in Gosaba we stayed in one hotel, a small hotel. So there we were getting this green water. So initially when we went there, so in that flush tank, when I flushed, so I saw green water. I thought maybe they are using these harpic cubes. So then like my other colleagues, like they said that did you see water was green? I said maybe because they are using this harpic. Then said no, even in wash basin it's coming. So like we were there for 4 5 days, and we used that green water, and then every day taking bath with that green water, like that is like at block level and in a hotel, and it's a tourist place because it's an entry point for this tiger reserve. So then you can imagine the situation in remote areas.
It's really bad situation all over these villages. I also traveled in a village, but in a very secured, what to say, secured environment. Means I cannot even stand and imagine what kind of problems they are having, and
Actually
there is
we
a little bit solution on this.
we
It's a
have produced a documentary, so maybe I can share it with you. Like we are
yeah.
going to stream it on Waterbear, so we are waiting for that. So I'll share that documentary with you. It's quite eye-opening. We organized a premiere at Water Forum also last month in Bali. So you can see, like when you see through your eyes, you'll understand it better. So I'll share that link with you. You can forward it to all the members.
Yeah, yeah. But
It's
whenever
a,
you
it's
have,
a
you find time, you just connect some of those ladies, those who are having such kind of problems to
Yeah.
this GWNN. So we could try to find out some solutions for them.
Yes, yes, yeah.
Isn't it?
So for them, that's what like challenge is multifaceted. We say see it's we see that okay, it's salinity and pollution, but then there's like it's all interconnected. Why they are not able to afford or access water? So then it's like or sanitary napkins. So it's all interconnected. Like how cyclones are impacting them, then how it's impacting their livelihood, socioeconomic situation, and then they are helpless because even we spoke to doctor. He said that he himself said that whenever these people they come, I suggest them that no, don't take bath in ponds, but they don't have any alternative, so like they feel helpless. And then um, uh, yeah, I just forgot that point. I will share. Okay, I'll share. I think sir has something to share.
Yeah, yeah.
uh,
Yes.
it's a
Someone,
very
yes.
nice presentation.
Yeah.
My appreciation and
Thank you so much.
congratulations. And we have to focus more on this aspect. See, when I visited Sundarban, I saw a lot of skin diseases with women, lot of
Yeah.
skin diseases. In addition, the crocodile attack.
Yeah.
So more crocodile attack on women rather
Women.
than men.
Yeah.
Because of that blood smell,
True.
the crocodiles are attracted. So very serious issues. All these things are very serious issues. I think my congratulations for all your service to the women.
Thank you so
We
much.
need to do more.
Yeah, this like as you were sharing this, so when we spoke to them, like we were discussing, so women they shared that see they have limited window when they go for fishing. It's like around full moon and new moon. So so that time, even if they are menstruating, they have periods, they need to go. They cannot avoid it because they don't have alternative. It's so they go even during menstruation. They go there, and then you said that they have different kind of risk because they have wild animals, they have then infections, lot of issues. And we hardly talk, when we talk about Sundarbans, we hardly think about imagine about such issues.
Ma'am, I have a question.
Yeah,
Uh,
please.
in what ways do gender sensitive urban planning and design address the intersections of climate change, water, and gender equality?
Could you please just
Uh,
give me the context?
yeah, means in what ways do the gender sensitive urban planning and design is done for water and gender equality?
Yeah, exactly. So here, for example, I'm giving you one example I shared, women living in informal settlement and also in schools. So we also provide like work with schools, especially public schools in urban areas, underserved schools. So, most of the time they don't have like proper adequate water supply or wash facilities. And then there also, you need to understand then that girls need more water than like boys. It's not like boys don't need it, but then definitely when they have periods. So that's why like many times you have dropouts because during periods, these girls, they don't come to schools because they don't have facilities to change their napkins, sanitary napkins, to like proper water for wash, because you need more water during that time. So these are the issues when you talk about educational outputs, uh, 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 learning outcomes. So when learning outcomes doesn't always depend only on education or like this mm, like these subjects like teaching, but it also needs environment where children can feel protected, they can feel safe, they have like healthy environment, and these things should be taken care when planning. For example, here in Telangana, they have government scheme, but then for schools for providing toilets and wash, but then there's hardly the mention of such issues. Like they need like girls, they need some special um, care or some special for example, they need napkins, they need water, so those things are not there, so then they don't have any options. So then that is and then poor are the, because see, when we talk about intersectionality, women is not a homogeneous group. That actually applies in both the cases, rural and urban setting. Women are not just the like homogeneous group, it's heterogeneous. So we also need to look into intersectionality. For example, in Sundarbans, we need to see that fisher women are more vulnerable than anyone coming from a well-off family. And in the same time, like girls, adolescent girls who is living in a slum and also in a like proper house or going to a like proper school, they are at a like different level. You cannot generalize. So as you rightly said, that it's very important to consider intersectionality. For example, sanitation workers, garbage collectors, I said that even if they can afford, because there are layers to this, it's not like linear equation. There are like so many, lot of social dynamic, lot of layers into this, like as it's so complicated, because sometimes you also feel what could be the like helpless, because a solution for real world problems are not very easy, they are very complex. But then we shouldn't lose hope, we should keep trying, because then only we can come up with something. But the more important part is like when you are trying for to find answers or solution, you should make sure that these people should be involved at all the levels. So that's why like whenever you're planning any initiative in urban, try to make it more participatory, involve these community members, especially women from different social socioeconomic groups, different livelihood groups. So I think is it like that's how like you actually address intersectionality in urban planning. The participation, involvement, engagement is the key.
Thank you, ma'am. So still anyone, they can ask their question. Uh, with this, we can conclude. Okay. Before we conclude, I would like to extend our sincere gratitude to our esteemed guest for their invaluable insights, expertise, and time. Ma'am, your contributions have truly enriched our discussion and enhanced the overall experience for all the members. So thank you, ma'am, once again. And I would like to request to confirm if any of our members will like to host the meeting for the next month. So kindly email us in advance. And to be a GWNN member, kindly visit to register on our website and become our registered GWNN member. Our next meeting will be on 3rd July next month. So we will mail you regarding this in advance. And if any of our participant has missed today's meeting, they can watch it on YouTube later. And once again, thank you all the members for your time and dedication. See you in the next meeting. With this, I declare the end of the meeting. Thank you.
Thank you so much for
Thank
the
you.
network.
Bye.
Give me this
Bye.
opportunity. Yeah. Bye.